Good morning, students.
Good morning, sir.
Good morning, sir.
Okay, students. Today we are going to discuss 4 5-mark questions in 2012 February question paper.
Okay, sir.
Okay, let's begin. Okay. First question is inversion and eversion of the foot.
Grace, do you know the answer? Yes, sir. Inversion and eversion are movements which occurs at the ankle joint, referring to the rotation of the foot around its long axis. Inversion involves the movements of the sole towards the median plane, so that the sole faces in a medial direction. Eversion of the foot, titling of the sole of foot away from the midline, performed by the fibularis brevis and fibularis longus. Inversion of the foot, titling of the sole of the foot inwards, towards the midline, performed by the tibialis posterior and tibialis anterior.
Good, Grace.
Thank you, sir.
Okay, students. The second question is intercostal space and its content. The answer is border by the rib above and below the deep fossa of the thorax, superficially in the endothorax fossa and pleura. Internally, the intercostal space contains essential respiratory muscles, the nervous and vascular supply to the thoracic wall, and contributes to the integrity of the thoracic cage. The 11 paired intercostal spaces contain the intercostal muscles, nerves, arteries, veins, and investing fossa. The intercostal space are filled by the 3 groups of intercostal muscles: external, internal, and innermost. Moreover, they are transferred by the nerves, arteries, and veins. Contents are intercostal muscles or external intercostal muscles, internal intercostal muscles, and innermost intercostal muscles. Neurovascular bundles are intercostal nerves, intercostal arteries and intercostal nerves, intercostal lymphatic. Intercostal respiratory mechanics. Clinical notes _intercostal brevis, intercostal flaps, intercostal nerves block. Okay, next question is sternocleidomastoid muscle. Dos, tell me the answer. Okay, sir. Sternocleidomastoid muscle from 2 locations: the manubrium of the sternum and the clavicle. It travels obliquely across the side of the skull by a thin aponeurosis. Insertion. Mastoid process of the temporal bone superior mehul line. Artery. Occipital artery and the superior thyroid artery. Nerve. Motor spinal accessory nerve. Sensory. Cervical plexus proprioceptive ventral rami of C2_3. Actions. Unilaterally conlateral cervical rotation, ipsilateral cervical flexion, deviation of sternum, and assist in forced inhalation. Final question is popliteal fossa. The popliteal fossa is a diamond-shaped area located on the posterior aspect of the knee. It is the main path by which vessels and nerves pass between the thigh and the leg. Borders the popliteal fossa is diamond-shaped with 4 border are formed by the muscle in the posterior compartment of leg and thigh. Superomedial border, semimembraneous. Superolateral border biceps femoris. Inferomedial border, medial head of the gastrocnemius. Infralateral border lateral head of the gastrocnemius and plantaris. The floor of the popliteal fossa is formed by the posterior surface of the knee joint capsule popliteus muscle and posterior femur. The roof is made up 2-layer popliteal fossa and skin. Contents the popliteal is the main conduct for neurovascular structure entering and leaving the leg. Popliteal artery, popliteal vein, tibial nerve, common fibular nerve. The tibial and common fibular nerves are the most superficial of the popliteal fossa. They are both branches of the sciatic nerve. The common fibular nerve follows the biceps femoris, tendons, traveling along the lateral margin of the popliteal fossa. Okay, students, we finished. Thank you, sir. Okay, students.